everyone. The section will start in 5 minutes time. For your information, this section is live on Facebook as well. You may invite your friends or your family member to join us. Good afternoon, everyone. My name is Kelly, representative of PJ Vision Agency, and it's my pleasure to be your moderator for today's sharing section. Today's section are collaboration between KBJ Klang and AIA PJ Vision. And I would like to extend a very warm welcome to all of you. Okay, back pain is a very common problem and it will affect many of us at some point of time of our life. The question is the pain just a simple strain to a muscle, or the pain has persisted over a long period? Today, we are lucky to have Dr. Goh as our guest speaker. If you have any question, you may ask Dr. Goh at the end of the section. All right, before start, I will mute you all so that the section will not get interrupted. Now, let's kickstart with a short video clip.
A critical illness plan that supports you from prevention to detection, from illness to recovery. What would such a plan look like? Introducing A Life Beyond Critical Care, which offers prevention by helping you manage your health. Coverage of critical illnesses from early to advanced stages. Support to ensure you get the best treatment available. What if you end up not needing any medical support? Then you can get up to 150% of your total premium back upon maturity. Because we believe that care should be complete. A Life Beyond Critical Care. Complete healthcare that prevents, protects, and supports.
Welcome back. The short video that you were watching just now is a comprehensive critical illness plan that protects you from early stage to advanced. The top 3 benefits of the plans are: first, you can get a 100% claim on early stage of critical illness that cover up to 180 conditions. Secondly, you may get 100% payout of coverage amount due to admission to ICU, which require mechanical ventilation for 5 consecutive days. These include COVID cases too. Third, if you do not make any claim throughout the years, upon maturity, you will get a guaranteed maturity benefit up to 150%. If you would like to know more about this plan, feel free to contact the person that invited you for this sharing or leave a message in our Facebook page. We will contact you as soon as possible. Without further delay, let's welcome Dr. Goh from KPJ Kluang to share with us back pain, causes and treatment modalities. I'm passing the floor to Puan Azlina from KBJ to introduce Dr. Goh. Thank you.
Hi everyone, and warm greetings from KPJ Kluang Specialist Hospital. Welcome to today's session. Thank you AIA, especially PJ Vision Wealth Management, for giving us the chance to participate in this session. My name is Azlina, and I'm the marketing exec in KPJ Kluang Specialist Hospital. I believe that nearly everybody gets back pain at some point of the time in their life, and to help understand more on the causes and treatment, I would like to introduce today's speaker, Dr. KIAN. He's from Kuantan, graduated from International Islamic University Malaysia in orthopedic surgeon. He has been working with Hospital Tengku Ampuan Afzan and a lecturer at International Islamic University Malaysia since 2012 and have joined KPJ Kluang in January 2020. Without further ado, please join me in welcoming our speaker, Dr. KIAN Liang, with the topic back pain, causes and treatment modalities. Thank you.
Okay. Okay, sorry for the delay. Hello, everyone. I'm Dr. Goh, orthopedic surgeon in KPJ Kluang Specialist Hospital. It's my pleasure today to present the topic on back pain to all of you today. And first of all, I would like to extend my thanks to EIA, organizers, and our marketing department for organizing this talk. Okay. So before I start, I would like to give some introduction to the topic of back pain. So about 80% of our population are actually suffering from back pain. And this is actually the leading cause of disability worldwide. And it is also the third most common reason for visits to doctor. And 50% of adults in their life have back pain symptoms each year. And in this 8% population has actually a very severe low back pain. And this impacts 1 in 3 people in their everyday life. And it is also one of the most common reasons for missed work. If you look at global data, low back pain and neck pain actually ranks number 4 in terms of overall diseases. And our evolution from a curved back to a straight back, and maybe because of our evolution, we end up with a curved back, which may lead to back pain. Okay, so back pain can be classified according to the duration. Okay, acute pain happens when it is less than 6 weeks, which is more common and usually caused by trauma such as accident or fall. Subacute pain lasts from 6 weeks to 3 months, and chronic pain usually lasts more than 3 months. Pain is actually a protective mechanism, and the pain signals are transmitted from the pain area to the brain, and this is interpreted as pain. And following that, a reflex action in the back happens, whereby our paravertebral muscles will go into spasm, and this is to protect the back and to keep the damaged area immobile. There are generally 2 types of back pain. Number 1 is mechanical, which is the most common type, and this usually results from damage or injury to the muscles, bones, ligaments, or joints. The second type is a nerve type of pain, or the radicular type of pain, when our nerves become inflamed or impinged. In terms of the types or the location of back pain, the lower back pain is the most common type, and this is followed by neck pain, upper back pain, and middle back pain. Okay, so briefly, I will talk to you on the spine anatomy in order for you to understand better regarding back pain. Our spine actually consists of 33 vertebrae and 23 intervertebral discs. Okay, if you look at the spine from the front, there are 7 cervical vertebrae, which is the neck area. There are 12 thoracic vertebrae at the chest area, and 5 lumbar vertebrae at the waist area, and followed by 5 sacral vertebrae and the coccyx or the tailbone. And the spine is actually not straight, all right? If you look at from the sideways, it actually consists of multiple curvature, which is the normal curvature of the spine. Our C1 or the neck vertebrae, the first is also known as atlas, and the second vertebrae is known as axis. And the thoracic spine is important because of the attachment to the rib cage. And the lumbar spine is the biggest among all the vertebrae because it has to carry more body weight. Right? And the intervertebral disc is actually a flat, round cushion which acts as shock absorbers. And the spinal cord is an important structure that runs in the spinal canal and forms the communications between the brain and the body. It has branches. It has branched into 31 pairs of nerve roots. Right, this is the anatomy of the spinal nerves, where you can see the spinal cord in the center and the spinal nerve roots, right, formed by the dorsal and the ventral root. And there are several conditions that affect the spinal cord and the spinal nerve roots, right? For example, the herniated disc, okay, anteriorly or from the front, and the thickened ligamentum flavum. All right, this is a yellow ligament situated at the back of the vertebrae, which may become thickened over age and compressed on the spinal cord. And another condition is a bony spur that may occur around the neural foramen that may compress the spinal nerves. All right, this is spinal nerve topography. All right, and you can see that the cervical spinal nerves actually supply mainly the upper limb. The thoracic or the spinal nerves around the chest, all right, will supply the chest and the abdomen. And the lumbar spinal nerves will supply the lower limb. The spine allows our flexibility in 6 different directions, right? Mainly in flexion and extension, and side bending on the right and left side, as well as rotation to the left and right. Okay, so we go to the causes of back pain. Actually, this back pain is a complex condition with many contributing factors. Some of it are due to psychological factors, social factors, biophysical factors, and medical comorbidities, as well as individual pain processing mechanisms. And about 5% of the people actually attribute their lower back pain to their jobs. This is a list of spinal-related causes, all right, and I will explain some of these conditions. Okay, these are the most common type of causes of back pain, such as degenerative spine disease, prolapse disc, spine fractures, and so on. So the first one is the most common type of back pain is due to slip disc, all right, or known as prolapsed intervertebral disc. The most common site of slip disc is actually the L4, L5 level, which is at the lower back. And it is usually radicular in nature, all right, means that it radiates from the back down to the leg and the foot. It is usually made worse with sitting, coughing, sneezing, and straining. If you look at this diagram, you can see that the different posture actually affects the pressure in the disc, whereby if you look at the patient standing, all right, in the bad posture or carrying heavy weights, or patients sitting in bad posture and carrying weights have the highest intradiscal pressure, and this may affect the back and leading to back pain. All right, this shows the anatomy of the spine, of the disc. The disc is actually made of two parts. The outer part is called the annulus, which is a tough fibrous layer, and the central part is the nucleus pulposus, all right? It is a soft material, and when there is a tear at the annulus, the soft central part will herniate through the tear and cause compression on the spinal nerves. And this leads to the symptom of radicular pain in a slip disc. There are several stages of this herniation, all right? The first stage, when there is an annular tear, all right, the central nucleus will herniate through the tear. When the disease advances, the disc becomes prolapsed. And when the annular tear is more serious, there is an extrusion of this material into the spinal canal. And lastly, when these materials become free-lying in the spinal canal, it is called sequestration. Usually, an X-ray is taken to look at to rule out certain conditions of the spine. In the case of slip disc, there is loss of the alignment of the disc, alignment of the spine, whereby we call this the loss of lumbar lordosis. All right, you can see that the spine is actually very straight. All right, in opposed to a normal spine which has a curvature. So sometimes MRI is required to assess further, and in this situation, you can see that, all right, at the normal level of the disc is actually consists of a bright center which contains a fluid and a dark periphery. All right, this is a normal appearance. But when we have an injury at the back due to slip disc, you can see that the central disc has become degenerated and dry up. Okay. And this may lead to the symptom of sciatica in a slip disc. Okay, for the next condition, spinal stenosis means the narrowing of the spinal canal, all right? And this usually occurs in elderly people who has a degenerative spine disease. Okay, as you can see in the normal spine, the spinal canal is very spacious. In a stenotic spine, right? So one of the cause of compression to the nerves due to the herniated disc may be contributed by the thickened ligamentum flavum and also facet joint hypertrophy. This facet joint is a joint between the two vertebrae, and this joint, like any other joints, become degenerated and cause compression to the spinal cord or the spinal nerve roots. And also bony spurs at the neural foramen may cause compression to the spinal nerve roots. All right, on the X-rays, we will see a lot of degenerative changes where you can see a lot of osteophytes. Osteophytes are actually a projection of the bones, all right, due to degenerative changes, all right. And on the side views or the lateral view, you can see a lot of osteophytes. And this usually gives a clue that this is a problem with spinal stenosis. And MRI may be helpful to evaluate the severity of the disease. And in this case, there are a lot of compression on the spinal cord, okay, and it may cause neurological symptoms in these patients. All right, they may have numbness or weakness of the lower limb. Another condition that we consider, especially patient with injury, is vertebral fractures or dislocations. It's commonly due to fall, all right, and more commonly, spine fractures may result from a motor vehicle accident, from workplace injury like heavy objects falling on the back, from accidents like in swimming, or also another common cause of spine fractures is fall from height. And X-rays will actually reveal the diagnosis in most cases where you can see there is a fracture of the spine. And some of the treatment for spine fractures includes a spinal orthosis, depending on the location and the severity of the fractures. In other conditions, treatment with body casts may be required, and certainly if the spinal nerves or the spinal cord is involved, surgery is required to decompress the spine and may require instrumentation and fusion. Another condition that we sometimes see in the orthopedic clinic is scoliosis. Right? Scoliosis is actually the deformity of the spine, and a lot of these condition happens in the adolescent age group. Okay, and we can see the S shape of the spine, which is not normal. And these young adults usually present with either deformity of the spine or backache. And some of these patients with very severe scoliosis may require surgery for correction of the scoliosis. Some of the backache may be due to spine infection, all right? And this usually happens in patients with some medical comorbidities like diabetes. And it can generally be due to bacterial infection or tuberculosis. Okay? And in this, in spine infection, there is usually formation of the abscess, all right? And this abscess may compress on the spinal cord or on the spinal nerves and results in the weakness and numbness of the limbs. Or some patients may become paralyzed due to this problem. And this usually requires antibiotics, and in certain cases may require surgery to treat the infection. So here the MRI of the patient shows the abscess is a TB spine causing the abscess formation and compression on the spinal cord. And the picture of the back in this patient shows a gibbous formation, which is typical in the case of TB spine. So another condition that we need to consider is spine tumor. Usually, spine tumor, especially the most common type is bone metastasis. This usually occur in the older age group. The patient may have the prior tumor due to breast, lung, thyroid, kidney, and prostate cancer. And a patient with a spine tumor may present with symptoms of pain, come with fractures, having neurological deficit, and inability to walk. All right, so any patients with any prior tumors with back pain, we need to consider bone metastasis. So this X-ray shows quite an extensive destruction of the vertebra in the cervical area. In the next, you can see in the MRI also there is a lot of destruction of the spine due to the metastatic bone disease. In many situations, doctors may get a bone scan, all right, to evaluate the involvement of the bone metastasis in the entire body, right, which you can see in the bottom picture. This is a common problem, especially in the office workers, which is poor posture, all right, due to prolonged sitting or prolonged standing. Okay, or sometimes we call the office syndrome. Other symptoms that patients may have include headaches, shoulder pain, as well as back pain and neck pain. This also may be contributed by prolonged usage of smart devices. As you can see, the more neck flexion or the more if you stoop forward, our neck bend forward, the more pressure that the neck has to withstand, and this may cause a lot of neck strain and leading to back pain and neck pain. All right, and back posture also may be back posture may be another contributing factors leading to back pain. Okay. So these are some of the non-spinal related causes of back pain. All right. So number one is obesity, pregnancy, psychological stress, or maybe due to surgical problems such as kidney stones, aortic aneurysms, or other conditions such as osteoporosis, fibromyalgia, or gynecological problems. So what are the risk factors for back pain? Right? So some of the problems like smoking, obesity, if the job is physically demanding and requires a lot of physical work, so this may contribute to the back pain. Any patients with prior history of low back pain also is at risk of having another episodes of back pain. And medical conditions such as asthma, chronic headaches, and diabetes also predispose patients to having back pain. And a lot of patients who are not physically fit are also more prone to have back pain due to the poor lifestyles. And mental health is also important because depression, anxiety, and stress may also be one of the predisposing factors for back pain. And patients with low income and low education may also at risk of developing back pain. So the diagnosis of back pain requires a complete medical history and physical examination. This is to determine the duration, location, severity, and the functional loss related to the back pain. A lot of time X-ray is required for confirmation of the diagnosis in the case of fractures, dislocations, and degenerative spine disease. In certain situations, MRI is helpful to look at the bone and soft tissue anatomy, and also to delineate the abnormal lesions that we may see on the MRI. And certain conditions or diagnoses may require bone scans and further blood tests, all right, to get to the diagnosis. So there are several things that we can do to prevent backache. Number one is to practice good posture. And we can certainly do more exercise to strengthen our core muscles and to increase the flexibility of our spine. And this also helps to reduce stress. And we should also try to avoid long periods of inactivity. And we should try to get up and move every 20 minutes to reduce the chance of getting backache. And also, we need to try to have to walk every day and wear shoes that help to facilitate good posture and try to avoid high heels. And whenever we need to lift heavy objects, we need to make sure our back is straight and try to create good working environment, which help with reducing the problem of backache. Okay, certainly relaxation techniques and cognitive behavioral therapy is helpful, all right? Okay, this is how we should maintain our posture while lifting weights. And when we stand, we should have a balanced upright posture where the ear, shoulder, the hip, and the ankle should be in a straight line. For sitting posture, our back should be straight. Okay, we should not slouch forward, all right? And if you are doing a desk job, all right, so our eye level should be same level with the computer to prevent slouching. Okay, we should use chairs with good lumbar support, and when sleeping, we should have a mattress with good back support as well, and try to avoid sleeping on stomach, right? Because this will increase pressure on the vertebra, and of course, very important is to maintain ideal body weight. Certainly, stop smoking will help with reducing backache. Need to have regular exercise and get enough sleep. Okay, so we come to the treatment of backache. Right, the mainstay of treatment is number one, medication. Secondly is physiotherapy and surgery. Okay, so there are no vaccine for back pain. So for medication, NSAIDs or non-steroidal anti-inflammatory drugs are the mainstay of medical treatment. This is mainly to reduce inflammation and pain. Right, and we have other analgesics such as paracetamol, codeine, and so on. Topical analgesics is helpful in the to give a sense of warmth and coolness, all right, and this will help to reduce the sensation of pain. Other relaxants is also another medication that is usually prescribed to reduce muscle spasms. And anticonvulsants, all right, such as gabapentin or pregabalin, sometimes is prescribed to reduce pain due to the compression of the nerve. Physiotherapy is a very good modality to reduce back pain. And some of the modality that is prescribed includes heat therapy. This is usually done to increase the blood flow to the affected area, to reduce the stiffness, and this is usually done after the swelling, the initial swelling has reduced. Cold therapy usually started for the first 24 to 72 hours after injury. And physical therapy is done to strengthen our back and to improve flexibility and mobility. Right, these are some of the exercises that your physiotherapist may recommend you to do. Okay, and traction sometimes is prescribed to help with back pain, all right, to maintain the spinal alignment. And transcutaneous electrical nerve stimulation, or TENS, is also sometimes prescribed, all right, to block the pain signals, and this thereby reducing the pain. There are several non-surgical procedures that can be advised, right, for back pain, which includes epidural steroid injections, facet joint injections, radiofrequency nerve ablation, and also laser discectomy. These are some of the newer modality that is available to treat backache. Epidural injection is actually an injection of mixture of steroid and local anesthetic into the epidural space, and this will help to reduce inflammation around the area of nerve compression and reducing the pain. Sometimes the backache is due to the degenerative changes around the facet joint, and facet joint injections will be helpful, all right, to reduce inflammation around that area. Okay, radiofrequency nerve ablation is a technique whereby radiofrequency probe is inserted nearby the nerves that supply the facet joint, and this will actually block the pain signal and gives temporary pain relief to a lot of the patients. For slip disc, one of the treatment that may be suitable is percutaneous laser discectomy. All right, in this modality, is a needle with a laser energy is inserted into the disc. All right, and the laser energy is given. This will shrink the disc and relieve the compression on the spinal nerve roots. And surgery, there are several types of surgery that may be indicated depending on the conditions, right? Example, spine decompression and fusion, discectomy for these problems, all right? Instrumentation if the spine is unstable, and also intervertebral disc replacement. Okay? So some patient with fractures or with degenerative spine disease with nerve compression may require decompression and fusion of the spine. Okay, and discectomy is indicated if the patient has severe prolapsed disc and may require open surgery to remove the disc and to relieve the compression on the nerve. And with evolution of surgery, we increasingly we see more endoscopic discectomy being done to do the discectomy because it involves a smaller surgical incision and a faster recovery for the patient. And this in some specialized setting, maybe intervertebral disc replacement is suitable to replace the diseased disc. So what are the prognoses of back pain? So around 50% of the patients may continue to have fluctuating pain with low to moderate in intensity. However, actually a lot of patients will improve significantly within 6 weeks. And after a year, usually the pain levels are very low. About 66% of patients may still report some pain at 3 months and 12 months. And the risk of having back pain again within a year is at 33%. Okay, so that's all for my presentation. Thank you.
Thank you, Dr. Do. Thank you for your wonderful sharing. So now is the Q&A section. You may unmute yourself or you can type in the question in the chat box. It's on the right-hand side on the screen. While waiting for the participants to key in the questions, I have one question, Dr. Goh. Wondering, I saw most of the people, they jog every day. Actually, will jogging, injure our back?
Okay, that's a good question. Of course, if a patient with pre-existing back problem, okay, jogging is a good exercise, all right, for muscle conditioning. But you need to have the correct tools, especially the shoes, all right, and have to make sure the posture is right when you do jogging, right? So to answer the question, yes, jogging actually is helpful for back pain. Actually, it can improve our muscle conditions, all right? But if the jogging is done like without taking care of the back, without without the patient having aware how's the back posture and so on, so of course that will make the patient more prone to injury. So in general, the jogging would not actually cause worsening of the back problem.
But maybe it's more to the knee problem, is it?
Yeah. Possibly the knee problem may get worse if it's very strenuous type of jogging. But I think light jogging, brisk walking, and all that certainly would not cause worsening of the back pain or the knee problem.
Okay, Dr. Goh, we have a question from B asking that, is back pain will cause leg pain as well?
Okay, so like in one of the slides, I was talking to you regarding the slip disc, right? And the other conditions is spinal stenosis, all right? These two conditions will certainly cause leg pain because the disc, all the degenerated spine at the back cause compression on the nerves at the back. And the nerves, the pain signal, okay, will travel along the same nerve, and patient will have pain, all right? They will complain of pulling pain at the calf area or the leg area, right? So certainly it is related to the back pain, all right? So patient with slip disc or spinal stenosis will certainly have leg pain.
Okay. We have one question from Facebook by Noor Aziam asking that, what are the best exercise can do for PT with backache?
Okay. So the question is the best exercise, all right, for backache. All right. So generally, we need to do a back strengthening exercise. Okay, so there are several exercises that I show earlier in the slide. Okay, and this usually to strengthen the back and improve the mobility of the spine. And I think the best person to discuss or to treat is the physiotherapist. All right, if you need to strengthen or to have further what you call improve the mobility of the spine. Okay, you can seek the expert treatment from the physiotherapist. All right, and they will tell you regarding all the exercises that may be helpful for backache.
Okay, from the same person, Nor Azian, asking, for Muslim PT, post-surgery, can do solat?
Okay, so for Muslim patient post-surgery, okay, can do solat. So actually, it depends on the type of surgery. Okay, so because there are a lot of different conditions of the spine and there are different type of surgery. Okay, so so you really have to discuss with your doctor after surgery whether what are the do and don'ts that related to the surgery that has been done. Okay, because we cannot just based on the general statement, all right, to say whether a person can do solat. Okay, so it's best that you discuss with your doctor whether you can perform solat after surgery.
Okay. One question is, will back pain cause permanent disability?
Okay, so the question is, will back pain cause permanent disability? All right. So it actually depends on the cause of the back pain. All right. So I've discussed there are several causes. Okay. So some of the, especially like mechanical pain and all that, it is not permanent. All right. So it's treatable conditions. But if the back pain is due to conditions like tumor or infection or injury, trauma or fractures, all right, this may, in certain situations, results in permanent disability. Okay.
And what is the causes for slip disc, doctor?
Okay. So slip disc, a lot of the patients actually have slip disc after carrying weights, and so this is not just a normal weight, but usually related to the job. All right, they have to do carrying a lot of manual physical labor, and sometimes it's due to fall. Right, so sometimes they fall on the back or fall on the top, and this may cause a slip disc.
One more question is, how to prevent spinal stenosis?
Okay, so spinal stenosis is actually a degenerative problem. All right, degenerative means as the patient age. Okay, so the what do you call the condition of the spines is also degenerated. All right, become more narrow. All right, and there is no certain way to prevent the spinal stenosis, but it's probably we can elevate the symptoms of spinal stenosis. We make it less. Okay, so so in short, there is no way to prevent spinal stenosis actually. All right, but we can certainly take care of our back to make to prevent it, becoming worse and causing a lot of pain.
Okay. Another question for Liping, from Liping. Most of the children have X spine now. Because of the school bag too heavy, what are the treatment to recover it? Do they need to go for surgery?
Okay, Actually, it's not quite true that the children have the S-spine due to the school fact. Because just now when I discussed about the scoliosis, it's actually a developmental problem, right? So it's not related to the carrying weights. So it's more of some children or some adolescents have the what you call tendency, right, to get this problem. Okay? So it's just that this condition usually develop during their growth spurt, so we tend to associate with carrying heavy bags, and we need to detect the problem early. All right, so some programs are there to detect scoliosis in the school level, and if it's detected early, so there are some treatment, all right, non-surgical treatment that may be given to reduce the the chance of the disease getting worse, right? And if the disease, despite treatment, still become worse, then there are some measurement that we do on the spine to see whether the patient is indicated for surgery. Right? So not all patients require surgery. Only certain patients with a very bad angle require surgery.
Okay. There are two questions from two participants that almost asked the same question. They are asking whether we have any supplement or any food that can help to protect the spinal.
Okay, so usually there is no specific supplements for the spine, all right? But having said that, for the older population, especially in our Asian population, we see a lot of patients with osteoporosis, all right, because of lack of the calcium intake, and that sometimes will cause the compression fracture of the spine when the patients fall, all right. So in terms of supplements, all right, so probably calcium supplement, all right, will certainly help in terms of osteoporosis. Okay, and all right, that's all.
Will aging change the spinal or bone composition?
Okay. Yes, like I've said earlier, aging, as patient age, right? So the tendency is to get osteoporosis, all right? If we don't maintain enough calcium intake, so patient will end up with osteoporosis, and that will definitely affect the spine, right?
Okay. And normally, how much is the treatment for spinal?
Okay. This question I'm not very sure what type of treatment is referring to, so I think it has to be a bit more specific.
And how frequent for the spine treatment?
How frequent? Okay, so it depends on the diagnosis. Okay, so if it's let's say a back pain due to mechanical cause, all right, and there is no problems like slip disc or spinal stenosis, all right. So usually it's just for pain management, all right. So medication, physiotherapy, that will help, right? So probably 4 to 5 sessions of physiotherapy with medication for several weeks that will help.
Another question from B. Will move pelvic bone cause imbalance leg length? Like for example, one side of the leg is longer and another side is shorter.
Okay, so move pelvic bone, all right. So this is a bit ambiguous. Okay, if the patient has some pelvic condition, definitely the leg line is affected because both our hips are articulating with the pelvis, all right. So definitely, if there is a pelvic problems, the leg line may be shorter or longer depending on the problems, all right?
Talking about the question, doctor, I have a question from my end. It's like, how do we share whether this is a pelvic bone problem or is actually a spinal problem?
Okay, this actually you have to really get a proper assessment, all right? Means that your doctor will ask about where is the pain generator, where does the pain come from? Is it mainly at the spine, or is it more of lower back or the buttock area, all right? And sometimes related to the old injury and all that. So those history are very important, right, to tell your doctor. And another important aspect is the physical examination, all right? Because certainly some of the hip problem or the leg problem actually comes from the spine, not from the pelvic area, right? So this is where the doctors will do a proper examination and they can diagnose, right, whether this is a back or hip or pelvis problem, right? And sometimes if it's still not very complementary, so we need the X-ray or maybe further imaging like MRI, right? This will definitely tell us the diagnosis, right? And only based on the diagnosis we can advise on the treatment.
Like for our health, we are advisable to go for medical checkup yearly so that we can know whether we are not well. But what about the spine? Do we have like some kind of like yearly checkup that we can do so that if anything goes wrong, we can rectify the problem before it's too late?
As far as I know, there is no sort of annual checkup for the spine. But maybe one of the annual checkup or that may be helpful is to do bone density, all right? To do bone density, especially for the older population, all right? So if they have osteoporosis or the severe osteoporosis and they get treatment early, so this will certainly help with reducing the problems at the back, right? So basically, it's related to their osteoporosis. And if you treat the osteoporosis, certainly will help with reducing the back problem.
And just now you were mentioned in the slide that sitting position is very important, right? So doctor, any guideline is like when we want to purchase a chair, it's like, what kind of chair that you would advise?
Okay, so any chair that you have that has a lumbar support, all right? Lumbar support means a support at your waist area, at your back, at the concavity area of your back. Especially if you need to sit down for a prolonged period in the office on the desk job, so you need to have a chair, right, that allows you to maintain your back in a straight posture, right? So when you purchase a chair, make sure you try and make sure that it supports your back. And not just that, when you sit, you shouldn't sit for many hours, all right? So every 20 to 30 minutes or so, you need to get up and stretch, all right? If you have a very good chair, but you sit for many hours, I think that also will not help.
Okay, thank you, doctor. Okay, one more question from Facebook, from Noor Hadia. She's asking, is massage encouraged for back pain?
Okay. So massage is also one of the modalities sometimes used in physiotherapy, right? So it depends on the problem, right? If it's just a mechanical pain, all right, so massage probably will not do a lot of, will not do any harm, right? But if it's back manipulation, all right, if there is a manipulation, so you have to be, need to be more careful, or if you've done a back manipulation, So, so you need to really look at the diagnosis, right, before we can say whether massage is encouraged or not, right? So,
Okay. So do you have, for all the participants, do you have any other questions?
You mean from me? Okay, so for take home message is all right. Back problem is very common. All right, so everybody should be aware. All right, how to maintain. All right, because definitely prevention is better than cure. Right, so if you take a few tips, all right, from the slides I presented regarding your back care, all right, certainly it will help if you think your back pain problem, right? But if the back pain is still, it's not getting better or it's getting worse, all right, so definitely you have to seek treatment because it's important to make early diagnosis, all right, and early treatment, all right, because once the back pain becomes chronic, all right, it becomes a long-standing problem, so it's becoming more difficult to treat, and the outcome may not be as good if this problem is left untreated. Okay.
Okay, we have a question from Dato' Dhoni asking that what kind of back pain is associated with heart problems?
Okay. Heart problems. Okay. Just now I mentioned one. It's not really heart problem. Maybe things like aneurysm. All right, aneurysm, aortic aneurysm, may cause back pain, and some surgical problems. All right, like sometimes even gallbladder stone, kidney stones. All right, may be confused or mistaken for back problems. All right. But specific heart problem per se, I'm not aware of specific conditions that may cause a back pain.
Okay. Thank you, Dr. Goh. If
Okay.
there are no questions, I will end the Q&A section soon. Once again, thank you, Dr. Goh, for your wonderful sharing. It's really informative, and I just learned the causes of back pain and the treatments method.
Thank you.
Before I end the sections, to all the participants, please scan the evaluation QR code and let us know the topic that you would like to hear from us. With this, I would like to end the sharing sections. Thank you for your participation. Stay home, stay safe, and stay healthy. Bye-bye. Thank you once again, Dr. Goh.
Welcome. Bye.
Bye.